I recently saw an interesting quote on social media recently, and it said, brush at night to keep your teeth, brush your teeth in the morning and keep your friends. Well, it makes sense, doesn't it? At a very young age, we were taught to brush our teeth twice a day, to gargle, to floss, that we need to take care of our teeth, our gums, our overall mouth, because oral health affects our overall well-being. Today on the show, we'll talk about some of the most basic things that we know about our teeth that we also often ignore. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk right here on CNN Philippines. Our dental health can affect our overall wellness. Problems with teeth and gums can actually lead to other health issues, and we don't want that to happen. Joining us today on the program, we have Dr. Alvin Laksamana. He's the president of the Philippine Dental Association. We also have Dr. Ashita Bhatia. She's the oral care scientist from Johnson & Johnson. Thank you both for being with us on the show. Now, we know to brush our teeth at least 2 times a day. We're told to visit our dentist twice a year, with or without any dental health problems. I'll start first with Dr. Alvin. Let's begin our discussion with why oral health is important and how it reflects our overall well-being.
Oral health is really important for the overall health of the human being. It has been researched and studied that it can cause some systemic disease that can lead to diseases on other system.
So pag hindi maganda yung ating oral health, pwedeng magkaroon ng problema sa ibang parte ng katawan. Now, Dr. Alvin, how can poor oral hygiene lead to other problems? Itong mga nakikitang problema natin sa katawan, hindi lang sa bibig.
Well, in our mouth, there are microorganisms that's teeming with lots of good and bad bacteria. That's why in our mouth, we have to contain this bad bacteria by properly practicing good oral hygiene. And it has been, again, in the study that heart disease, diabetes, pneumonia actually have a relationship between the oral health.
And that's very important because oral health matters because poor dental health increases the risk of bacterial infections in the bloodstream. So go see your dentist on a regular basis. Dr. Alvin, speaking of that, how often should that be? How often should our viewers visit their dentist? And also, we want to know what happens during these regular checkups.
Well, for a patient, have to go to their dentist twice a year, every 6 months. And then during dental checkup, we will be in inspection of other oral diseases that you might have in your mouth. So we are checking for dental cavities or tooth cavities and then gingivitis for that matter.
But now we want to talk about the most common dental problems. Number 1 on that is cavities or tooth decay. Dr. Alvin, paano ito nagsisimula?
Well, tooth decay and gingivitis actually start to forming a plaque or what we call biofilm. This biofilm is actually steaming with a microorganism that would cause our teeth to weaken and cause our gums actually to bleed. So we have to really control that biofilm accumulating on the surfaces of our teeth or in the gum line.
We'll talk more about that and all throughout the show because we'll share some interesting facts about your teeth or your mouth. Now, some you may know already, which is okay, but some we hope will be a revelation of sorts. So I want to bring your attention to our first factoid. Did you know that tooth decay is the second most common disease, second only to the common cold? That's interesting, right? Now, speaking of tooth decay, when that's a problem you have, bad breath becomes a problem too. Now, Dr. Alvin, could you explain this to our viewers a little bit more?
Well, if you have lots of tooth decay in your mouth, those are portion of our teeth that is rotten, no? As well as if you have a gum disease, it will have actually some odor in it. So you have to really see your dentist to treat those diseases so that you will not have halitosis, as we call it, no, or bad breath in layman's term.
Okay. Now, speaking of halitosis or bad breath, Dr. Ashita, is rinsing the mouth effective in trying to address this problem?
Yeah, actually, many people believe that you get bad breath, if you're eating like garlic or fish or something like that. But the real reason for bad breath is actually bacteria, and these bacteria produce these sulfur compounds. So, the best way to really get rid of bad breath is actually by killing the bacteria. And that's where a mouthwash can really help. So, they have antibacterial ingredients and they help to kill these bacteria and help to prevent plaque and cavities and gum problems. So that's where mouth rinse can actually be very, very effective.
Okay, and another common problem is gum disease or periodontitis. Now, Dr. Alvin, what are some of the symptoms of this condition and how can this be avoided or prevented?
Actually, periodontitis is the advanced stage of a mild gingivitis. So, in gingivitis, you have to look for bleeding of the gums. And for periodontitis, you have to look for mobility of your teeth. And we can prevent this by really brushing our teeth and improving our oral health and maintaining the bacterial content in our mouth. No, we don't have or we don't want to have more biofilms on the surfaces of our teeth so that it will not actually accumulate and actually calcify that biofilm. So we have to really brush our teeth.
Okay, and just a reminder to our viewers, bacteria in the mouth is normal. You have some good bacteria, you have some bacteria that you want to be there, but it's a balance of those colonies that we want to address. So you don't really want to sterilize your mouth, so to speak, but it's that balance, it's that good balance is what we want to try to achieve here. Now, Dr. Ashita, can you discuss how we should select oral healthcare products? A lot of people are familiar with their toothpaste, but I'd like to talk about mouthwash. How should our viewers select their mouthwash?
So it depends on what common problems you have. So if you have a lot of cavities or if you're prone to getting cavities, then you should select a mouthwash that has fluoride in it. Whereas if you tend to get bleeding of your gums and tend to have bad breath, then you should look for a mouthwash that has an antibacterial ingredient, say like essential oils. And if you tend to get those yellow, hard, what we call as tartar, that's also common when you have gum problems. So then look for a mouthwash that has zinc chloride in it.
Now we'll discuss other common dental and oral conditions and ways in which we can prevent them. Before we proceed with our discussion, I want to share yet another factoid. Our saliva has a fundamental role in oral health, and it's an important part of a healthy body. It helps us swallow when we eat. And at the same time, it contains enzymes that help with the initial process of digesting our food. And it's also a natural cleanser. But of course, it's not enough to clean our teeth and the rest of our mouth. Aside from practicing good oral hygiene, your diet also plays an important role in protecting oral health. We'll have more after a short break. Stay with us right here on MedTalk Health Talk. We are your partner in healthcare. You're watching MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. Our oral health needs to be a top priority. Here's another interesting fact. Did you know that the average woman smiles 62 times a day, while men smile only 8 times a day? Now, there are certain types of food that can be damaging to our teeth for one reason or another. Dr. Alvin, can you name some of these foods that our viewers should be aware of that may cause dental problems more than others?
Well, the first on the list will be the consumption of sugar that could actually cause tooth decay and other oral health problems. If you're going to talk about other beverages like coffee, tea, that would cause actually surface stains on our teeth.
Okay, that's good you mentioned the surface stains, because discoloration can also be a concerning problem for a lot of people. Now, what are some of the drinks that you mentioned, coffee, tea? What is it actually in these beverages that causes that discoloration in the teeth?
There are certain stains like actually found in the coffee and in soda, no? And of course, you also have You can also have a teeth stain if you are a cigarette smoker. The nicotine, that content of the cigarette that would actually be on the surface of your teeth.
Okay, that's good to know. Now, Dr. Ashita, when it comes to discoloration and teeth stains, does mouthwash have a role in this in trying to prevent it or even trying to treat it?
Yeah, so you would get specific mouthwashes that have ingredients, for example, like polyphosphates, that can actually help to prevent these surface stains. So, what polyphosphates do is they form this kind of protective layer on your tooth structure, and then the stains are not able to stick on to the enamel of your tooth. As well as, they react with what is called as the chromophore. So, that is the part of the food that causes coloration, and this polyphosphate will bind with that, so it helps to also remove these kind of surface stains from the tooth.
Okay, so a follow-up question with that, Dr. Ashita. So in a pinch, whenever someone isn't able to probably toothbrush for one reason or another, would a good temporary solution to that would be able to have a good mouthwash whenever they drink coffee or to try and prevent these teeth discolorations?
Yeah, so usually this is done over a period of time. So it would not happen that if you just swish one time, your teeth become white. So the important thing with mouthwash is that in order to see its benefits, you actually have to use it consistently, twice a day. So it can't just be that, oh, I have a date tonight, so I'm going to use a mouthwash and my teeth will become white. So you have to use it on a regular basis in order to really see the benefit.
Now, in line with that, Dr. Alvin, I'd like to ask about the type of toothbrush that people should use, because there are a lot of toothbrushes available for whenever someone goes to the grocery store. There's so many types of toothbrushes. What would you recommend as a good toothbrush for our viewers to use?
Well, first and foremost, you have to select the type of bristles. So the recommended would be a soft bristles for your toothbrush. But then again, you have to really come or go to your dentist and actually ask what would be the good toothbrush for my set of teeth. Well, there are specific toothbrush that is for specific set of teeth.
Okay, that's very interesting to know. How about the time in which people should be brushing their teeth? Because a lot of people probably rush into this. They probably brush for maybe 30 seconds at most, probably. Is this a average time? How long should they be brushing their teeth?
We have to brush our teeth a minimum of 2 minutes so that you will have to cover all the surfaces of your teeth.
Okay, so no rushing when brushing. But it's also not enough.
Yes.
Dr. Alvin, flossing is also important here, and that's another step that we cannot miss. How often should we floss?
We usually have to floss once a day so that we can actually remove the food debris in between teeth that our toothbrush cannot reach.
Okay, when it comes to flossing, Dr. Ashita, would you say that gargling a mouthwash would have similar an effect with that of flossing? Would it be able to get some of the particles or food particles out of the mouth and be able to rinse it out as well?
So ideally, the recommendation is always to brush, floss, and rinse. However, the brush is not flexible, so it cannot go in between the teeth. And mouthwash, because it is a liquid, it has the ability to go into all these nooks and corners and actually be able to kill the bacteria and also remove the food particles there. So definitely mouthwash could play that role in cleaning in between the teeth as well. But of course the ideal situation would be to brush, floss, and rinse.
Okay. So brushing and flossing and rinsing are dental care basics that we should never, ever ignore. But there's yet another step we can take to improve our oral health. Here on the program, Your Health Comes First. Don't go away. We'll be right back.
This program is brought to you by
Keeping our mouth, teeth, and gums clean and healthy can prevent disease. That's why dental hygiene is important. I'm Dr. Freddy Gomez. A 2017 study shows oral diseases affect close to 3.5 billion people worldwide, and cavities are the most common condition. But you know what? These oral problems can be prevented if caught early. That means visiting your dentist on a regular basis. Dr. Alvin, let's discuss some of the warning signs of dental health issues.
Warning signs for dental issues would be for tooth decay. You have to inspect your surfaces of your teeth. Look for some dark spots or brown spots for that matter. And for your gum health, you have to check for bleeding. And after brushing, you have to check the foam of your toothpaste if there are streaks of blood on the foam of your toothpaste. So that are the warning signs that you have to look for.
Okay, and earlier today, we talked about brushing and flossing a lot, but there's another step we need to talk about that can improve our oral health. Here's another fact though. Brushing your teeth only cleans 25% of mouth germs. That's why the use of mouthwash is also very important. Dr. Ashita, could you discuss this a little bit further for our viewers?
Yeah, so the thing is that brushing only really cleans our teeth, right? But we have a lot of bacteria, in other parts of our mouth. So like below the gum line, on the tongue especially. So that's where, a mouthwash can really help because it has the ability to clean your entire mouth, and it has the ability to kill the bacteria in the full mouth. And that's a really important thing.
Dr. Alvin mentioned that 2 minutes is the good time for brushing our teeth. For mouthwash, how long should we swish and swash?
Yeah, so typically brands would have their recommendation at the back of the bottle. So for Listerine mouthwash, it would be twice a day for 30 seconds. So usually, once in the morning, once in the night, like after you brush your teeth, that would be the recommendation.
Practicing good oral hygiene is the first step. But seeing your dentist twice a year is also going to be helpful. Dr. Alvin, why shouldn't we be afraid of seeing our dentist? Marami akong alam dyan na takot talagang pumunta sa dentista.
Well, that is a misconception. You have to really see your dentist. So we are giving smiles to you. So you not be afraid of us, the dentist. Sometimes because of the procedures that we have. But these procedures is essential for us to give you a beautiful smile.
Now, before we go, I want to hear first from our guests. So what are your tips to ensure your teeth and the rest of your mouth are in excellent shape? Dr. Alvin, let's start with you.
So my tip is actually brush your teeth twice a day within 2 minutes and use a fluoridated toothpaste. And if you want your oral health to be optimum, you can adjunct this by using dental floss and mouth rinses.
And Dr. Ashita, can you remind our viewers once again on the importance of mouthwash?
Yeah, so what mouthwash does it actually goes into the areas that you miss because brushing doesn't reach everywhere, and it also has the ability to kill the bacteria. So that's why it can be a real benefit to add mouthwash to your oral health routine.
Okay, that's very good to know. So when it comes to mouthwash, Dr. Ashita, before we go, I'm really curious on, does it matter if the mouthwash that someone is using contains certain ingredients? Should they try and make sure that they avoid certain ingredients that may be available in other mouthwashes?
So I think you need to do a little bit of research and see what is the best mouthwash for you. For example, if you look at Listerine mouthwash, it's the most clinically researched mouthwash. It's been around for over 100 years. So its efficacy and its safety has been proven. And at the same time, you also have to look at specific ingredients. It's important to use something that can actually give you the benefit. So you should look for a mouthwash that has proven its efficacy in clinical studies and that has the ingredients like I mentioned, fluoride or essential oils that can actually give you that real benefit that you need.
I'd like to thank our guest for today, Dr. Alvin Laksamana, President of the Philippine Dental Association, and Dr. Ashita Bhatia, our oral care scientist from Johnson & Johnson's. A healthy mouth is a healthy body. Your daily brushing, flossing, and use of mouthwash can help keep bacteria under control. We're glad you could join us today on the show. I'm Dr. Freddy Gomez. Thank you very much for watching.
This program is brought to you by